The University of Texas at Arlington College of Nursing Health and Innovation presents Medication Administration Policy for BSN J1 nursing students. The objective is to help you understand the importance of following the medication administration policy and procedures, the medication administration form requirements, and most important, maintaining patient safety and providing high-quality nursing care. Next, we will discuss student responsibilities before administering a medication. Let's review the student safety checklist before administering a medication in the hospital setting. Students must meet all the following criteria: must have passed the math exam with 100%. Successfully passed the medication administration checkoff for the current semester with the clinical instructor. Completed the medication administration form. Discussed the medication with the clinical instructor and received the clinical instructor's approval before administering the medication with a registered nurse. Give yourself a high five. You just learned the High Five Student Safety Checklist for medication administration. It is an important safety measure in place to ensure UTA students are providing high-quality nursing care and maintaining patient safety. Let's discuss medications that students are never allowed to administer as a J1 nursing student. J1 nursing students are not allowed to administer narcotic pain medications of any form by mouth, IV, or pain patches. Students cannot participate in a narcotic medication count or remove any form of narcotic from the Pyxis machine. Students are not permitted to administer non-FDA approved drugs, chemotherapy drugs, or blood products. During your J1 semester, students are not permitted to administer anything by IV or give injections. It is crucial as a nursing student that you understand what you can and cannot give during clinical. But if you followed your checklist, which is a safety measure in place to keep you from making an error you will be practicing within your scope of practice, remember, patient safety is our number one priority. Now we have reviewed all the requirements, let's review the medication administration documentation form.
Hi, I am Professor Witt and we are going to review the medication administration documentation form. Before administering any form of medication, it is the student's responsibility to look up the medication and complete the required medication form. Ensure to include patient information that is at the top, such as the age, sex, weight, and any allergies. Next, it is important to provide relevant information as it pertains to your patient. For example, the ordered dose, frequency, time due, and route that is specific to your patient. In addition, identify any supporting evidence such as why the patient is receiving the medication, labs, and vital signs that must be considered before administering a medication. You and your clinical instructor will then review the medication administration documentation form before you will be allowed to administer the medication.
Hi, Professor Witt. I have completed my medication administration documentation form. I am ready to give you a handoff report about the patient, and to discuss the medication and receive approval before administration.
Outstanding job, Michelle. You have completed your form, provided all the relevant data, demonstrated understanding of the medication, including the indication for the medication, associated labs, vital signs, patient education, and side effects.
Congratulations, you have learned the importance of adhering to the student safety checklist before medication administration. Next, your clinical instructor will review the J1 scope of practice, review clinical and lab expectations, medication folders and documentation forms, and the student medication administration contract.